Yeah. Okay, I will do my presentation in French, and as Jean-Louis just told you, I will switch many slides, so don't worry about. I will pass very quickly. Je
The common concern for all health systems is to find out how, in the coming years, systems and health organizations will be able to continue to efficiently guarantee equal and free access to quality health services. This is a very important question. What the society is expecting is a balance between equity, freedom, and efficiency. The health systems all over the world are influenced by major strengths, technology, development, knowledge, aging population, environmental changes, and there is a very strong budget constraints related to the financial crisis. Those various forces lead to a larger implication. Population's expectations are increasing, and there is still a strong requirement for society to control public expenses and deficit. This creates a crisis situation, and in every country, because of these double requirements to meet the population's need on one side and to control public expenses on the other side, this generates the following reasoning. We should be able to do more and better with existing resources, and to do so, we have to change organization practices and modalities. We have to face the performance challenge. This is a quasi-universal diagnosis, but the debate on the methods is quite intense. How can we change structures, systems, organizations, modalities in order to do more and better? To do more and better is the main objective around which change opportunities are structured. How can we develop leadership that will mobilize resources in order to create new stakeholders coalition to do better and more? To do better and more is possible only with simultaneous changes in the practices, in the organization, as well as in the structures. If we have changes at those three levels, we'll be able to improve performance. Performance is a very broad concept. It's the ability for a system or organization to adapt to the environment, to reach legitimate goals, to operate in a productive way, to generate quality using or applying values that will enable the stakeholders to bring about change. So the question is, how come we're not able to do it? How can we implement the necessary reforms? What kind of governance do we need to improve the system? Performance evaluation, is it a way to guide the system towards continuing improvement to do more and better? So to improve performance evaluation will involve information, knowledge, and cognitive capacities would reinforce the required coalitions to bring about necessary changes and to improve performance. This is broadly recognized principle in France, in Great Britain, in the USA. The health commissioner here in Quebec is stating it in a similar way and is offering performance evaluation tools and methods that are similar to what I described, a very broad vision of performance. In Quebec, we have several studies underway on how to measure performance at various levels, involving major data and indicators to assess performance in the various services, the performance of programs within those services. And this knowledge and data about performance could bring about some change. There is a broad consensus on the importance of assessing performance and the need to institutionalize it. Scientific data demonstrate that changing. There is few scientific evidence to demonstrate that those changes will bring up improvement. I'm basing myself on a report that is about to be published. It has been reviewing knowledge and the connections between performance improvement tools and performing transformations. So we have to come back to the hypotheses that are required, the mechanisms we have to understand when we state that a better performance evaluation will bring about transformation and change. Performance evaluation is a tool that enables the production of valid information and data, and it's a number of processes that enable various stakeholders to translate this information into judgments and eventually into action. So we have three processes, in fact, that are involved from evaluation to action. So first of all, an analysis, a scientific process, the diagnosis, and then we have interpretation, how will this information enable us to make some judgment, and eventually an action process that explains how the judgment can be translated into action. What we must understand that the three processes are interrelated. And what are they based on? We have to remember that in any system or health organization, we have various regulation logics, commercial regulations, managerial regulations, professional regulation, and democratic participative regulation. Professional regulation is quite important, and I'm basing myself on Abbott and Fritz's work, who worked on professional regulation. Those four logic patterns are involved in every health system. Any decision is based on one of these four logics. We have to recognize that each one will be dominating in one sphere, and any reform that would be based on one logic only, management, commercial logic, or political action, is doomed to fail. This might explain the problems we are faced with in performance measurement and results. So those four logics, I'll present them very quickly. The commercial logic is theoretically based on microeconomy. Consumers are informed about the performance and will select professionals or the best professionals or organization. And performance improvement will result from the consumer's selection of the most performing organization. The managerial logic, based on technical, classical management theories, will try to work on plan, do, check, act based on the organization's objectives, and there is an external pressure that the fact that the information on performance might change the organization's image and give relative advantage or disadvantage to the organization in face of the choices. In the professional logic, the professional behavior theory, again, based on knowledge, ethics, and profession and peer review. The professionals obtain information that might generate adjustments in their practice to improve quality and generate reflection on what professionals do. In a bottom-up, we have a bottom-up model. Professional practice is transformed from bottom up as the system consequently. Participative logic is based on the idea that public evaluation reports might generate debates on performance, on the organization, the systems, and those debates contribute to more democracy and will generate changes in public health policies and reinforce democratic process. So the public evaluation reinforces social standards in relation to performance and the system. Finally, to mobilize an optimal performance measurement in a change strategy, we have to understand that performance evaluation will have different impact on the various stakeholders based on their regulation logic. To increase performance assessment ability to bring about improvements, changes, we have to realize that the various change processes can take place simultaneously, and we have to be sufficiently alert so that to know that the changes are based on different theories, and those changes will act in a synergic way